kids are needing to have some kind of focus on health, it is fundamental. Having good health is absolutely related to success. It's absolutely related to achievement.
Give a young child the choice of sitting or getting out and being active, and chances are they'll pick this. And yet, there is a frightening epidemic spreading through the ranks of our children. Nationally, in grades K through 12, 1 in 5 kids are overweight or obese. And more than ever, children are reacting negatively to the stresses of violence, including not feeling safe, sometimes at home and sometimes at school.
Children are our most precious resource, and we have to do everything we can to make sure that they are healthy and they are safe and in secure environments so they learn. You know, I know from firsthand experience, being a poor kid from a poor family, that ultimately dropped out of school, and a lot of that because an unstable family, an unstable support system, not having food you need. And we lose a great deal of potential in our children when we can't nurture them through all of those trials and tribulations.
The risk factors may seem overwhelming, but know this, there are also those protective factors that schools can put into place to help even the playing field for our children. Study after study in schools all over the country confirms that even having just a few but very strong protective factors in place does make a huge positive difference in the lives of students, and healthy students achieve more in the classroom.
If you exercise, you're exercising your mind, your brain, and it makes you a lot healthier.
It is a team approach, and if done right, it can make a measurable difference in the academic success of every child in your school.
A child who is not properly prepared physically, unfortunately, isn't able to concentrate as well as a child who is prepared physically, both with food, with nutrition, with good health habits, exercise included. And the children who do get an opportunity to exercise in school have a better opportunity to learn. Their minds are better prepared.
And for older students, being healthy and safe also means being able to resist high-risk behaviors, including drug, alcohol, and gang involvement. It starts with helping young people treasure their own health and that of others.
This class also helps me relax throughout the week, so I'm not as stressed doing my homework.
I watch students come in to my classroom full of anger, very stressed out, very unmotivated. As I have chatted with the other teachers that have my students after yoga, they have remarked to me over and over again that students go from falling asleep in class, failing their class, arguing in their classes, that their perspective on life has been transformed.
Now, while there is no silver bullet to eliminate all risk factors, there is a known successful approach that may already be partially in place in your school or organization, but just lacks the coordination to pull all the pieces together. It's called the Coordinated School Health Program, an approach that consists of 8 interactive components. It begins with comprehensive school health education, physical education, health services, nutrition services, counseling, psychological, and social services, a healthy school environment, health promotion for staff, and finally, family and community involvement.
And it began years ago, and it's not a new model, but it was expanded upon in 1987 to include all these 8 components that were determined were necessary services for youth and young people to be healthy, productive, resilient.
The Centers for Disease Control promotes this approach because it is comprehensive in addressing physical, social, emotional, and psychological health needs, and not just for the individual, but for the entire organization.
Centers for Disease Control have been very supportive of this particular model called the Coordinated School Health Program model, and it's based in morbidity and mortality rates that affect our youth, meaning the illness and death rates that are the most prominent problems of youth. And this coordinated model is designed to counter that.
But the best part about implementing the coordinated school health model is that chances are your school or organization is already doing many of these things, but without an overall school plan, a plan that must be coordinated with the home and existing services in the community.
When I wrote my school improvement plan, I used the coordinated health categories as a way to discuss, okay, we feel, for example, in terms of health, faculty health and wellness, this is what we can do. In terms of parents and community involvement, this is what we can do. In terms of the physical and health education curriculum, this is the way we can improve it or expand it or amplify it without taxing the human capital. So it's a way to view your school and have a mechanism to discuss things in a formal way that makes sense.
Kind of a roadmap for you, isn't it?
It's exactly like that.
And it's about getting all areas of the school, from the playground to the classroom, from the bus driver to the school nurse, from the safety officer to the school principal, all on the same page. It is about self-assessing the resources you have so that you have a clear picture of what your students need. When you step back and you look at a school that is functioning in this wonderful coordinated way, what is it that you see? What is it that you feel? What are the outcomes of that school?
Well, you see parents wanting to send their children to that school because that is where their kids are going to do the best. You see positive. You see kids happy and joyful and exercising and balancing their life effectively with the academic side, which is very important, and this physical, mental, social health, that to keep that in balance and be positive.
To get things started in your school or organization, contact us for support and resources. Remember, this is a team approach for advancing health, safety, and success in our youth.